You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shade. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve, take a count for
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve, with my little pal Lady Diagnosis, a.k.a. she who will do most anything for a glass of expensive wine. Hello, Lady Diagnosis.
Hello, Dr. Steve.
And it's her boyfriend, Dr. X. Hello, sir.
Howdy.
Thanks for being here.
Thank you.
You're a lucky man.
Yes, I am.
This is a show for people who have never listened to a medical show on the radio or the internet. If you have a question, you're embarrassed to take your regular medical provider. If you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Pooh-head.
If you're listening to us live, I like how you say that. The number is 754-227-3647. That's 754-22
penis.
I knew you'd pick that one. I picked 754 Bear Nip. Or follow us on Twitter. I think your girlfriend set you up on that one. Follow us on Twitter at Weird Medicine, Lady Diagnosis, or Dr. Scott WM, and Dr. Scott will be back next week. Visit our website at weirdmedicine.com for podcasts, medical news, and stuff you can buy, or go to our merchandise store at cafepress.com/weirdmedicine. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, barista, yoga master, physical therapist, anesthesiologist, or whatever.
Brewmaster.
Or brewmaster. It is true. Poor old brewmaster John.
He doesn't ever come visit anymore.
Nope. Well,
Too
we only
busy.
started saying FPA John because he, when he started up the new business, he quit coming.
Oh, is that why?
Yeah,
I
so
was wondering
people would
why
say,
they say that.
why?
Poor Jill.
Right? Right. Where's John? And I'd just say FPA John, and then it started kind of a little thing. And reminiscent of F. Jackie on Howard Stern from the old days. So, anyway. Don't forget stuff.drsteve.com for all your Amazon needs. Stuff.drsteve.com. And next show, I will have a review of the Womanizer sex toy that's at the bottom of the scrolling, or the bottom of the page at stuff.drsteve.com. And I'll let you guys know if it's really everything that Dr. Perkins set it up to be. So we'll see.
I can't wait to hear that.
And tweakedaudio.com offer code. Why don't you guys just buy one and then we'll trade notes?
I was looking for my complimentary issue of that.
Well, I can't even get a free one.
I'll just use yours, Dr. Steve.
Okay. Well, the thing is, you don't touch it to the body. So actually,
we could all pass
it is
it
a sex
around.
toy that people could pass around.
Yeah.
You wouldn't want to use somebody else's dildo. That would be gross. Even a glass one, it's perfectly clean, but it's still gross.
A glass dildo.
Mm-hmm. Oh yeah, yeah.
Glass breaks.
Those
Danger.
big, thick glass dildos. I think they're safety glass, and they're not going to break.
Okay.
I mean, you could hit somebody over the head with it, and I'm sure
you don't
that's
know
happened.
Lady Diagnosis.
Oh, she could just break. Oh, I see. Ooh. Oh. Okay. Very nice, Lady Diagnosis. She's been doing her Kegel maneuvers.
Mm-hmm.
Yes.
I'm doing them right now.
I am too. So, I have a very tight vagina. Don't forget Dr. Scott's website at simplyherbals.net, simplyherbals.net, and tweakedaudio.com. Offer code FLUID for 33% off. The best earbuds on the market for the price and the best customer service anywhere. Go to blueapron.com/medicine and get 3 free meals by going to blueapron.com/medicine, and that's off your first order. And if you want to listen to archives of this show, go to premium.drsteve.com for $1.99. You can get all of the past shows. You can listen to them there.
Why would you not?
Or you could use the Weird Medicine app, which you can get on iTunes or Google Play. And that's the best way to do it if you're going to be a premium listener. We do sometimes have premium content that we put up there. Mm-hmm. All the ETN comedy stuff is there. And it's $1.99. So, and it helps keep us on the air, and we appreciate it. So,
do I get any of that money?
Well, do you get a check every time you come here?
Yes.
Okay, then yes. Then you're getting some of that money.
Okay,
that's how I pay you.
Okay.
And we are one of the few podcasts, by the way, that actually pays people for being on the show. So, Dr. X is a guest.
He's a
but
guest.
I'll give you his money.
Oh, okay.
That's why I'm looking for my complimentary
I know, your
toy.
I get
complimentary.
yours.
Oh, we do have a complimentary toy for him. It's right behind you, up above your left shoulder. There you go. Yes, we have a sex toy for you. It's called
the flatus flute. It's a good thing I don't have gas.
Well, next time you do.
You know what really kind of ticked me off is that when they do colonoscopies now, what are they using, nitrogen or something instead of what they used to use, CO2?
CO2 still.
Well, okay.
Air.
My guy was using nitrogen or something else that you don't get the delightful thunderous flatus afterward. And I had taken one of those with me to do my colonoscopy, and I do mine without anesthesia. And so I was...
Why?
Because I don't like the anesthesia. Propofol makes me goofy for like 2 days.
He just likes something large and black up his butt.
Oh, well, Dr. X. So he's fitting in very nicely on the show. So I but I did it without anesthesia, and one of the reasons was I could just pull up my drawers and go to work afterward. I didn't have to take a day off. And I wanted to shove a flatus flute up my ass and get video of it really demonstrating what it can do. Because you'll notice that's a picture of me on there.
So can't you just use it when next time you have
I
Mexican
could.
or
yes,
something?
but then it's just, the nice thing about doing it post-colonoscopy is you're not going to be shooting out any
clean.
liquid stool or anything, on the back wall.
True.
Because that's
the sphincter is an amazing thing that it can distinguish
incredible.
between gases, liquds, and solids, and
absolutely
selectively let them release.
It is amazing. Well, most of the time, you're
true.
successful with that. But people ask, well, how is it that the sphincter, or that the rectum can make a distinction, between those things? And it's like, okay, put water in your mouth, right? It's a smart ass. Oh, come on now. Yeah. Okay, we're all about fun here, but puns are anyway. It's fine. That was very funny. But if you put beer in your mouth, okay, there's a tongue there that has taste buds, but you can tell the difference between the gas where the liquid ends and the air. And I can't tell you how you do that. You just can't. If you puff up your cheeks full of air, you can tell that it's air and not liquid, and the ass is just able to do the same thing. There's just not a tongue in there, not of your own. There might be an exogenous tongue.
You said
in
that,
there.
not us.
And but there's no tongue in there to detect flavor and things like that. But you can definitely detect consistency.
I was going to say you can feel.
Yeah, you can feel. You know when it's liquid.
Yeah, you know.
But every once in a while you'll think it's gas,
Sometimes
but it's not.
Yeah,
a shart.
You're right. That's right. And so that's what I don't want to do. I knew my bowel was perfectly clean, and it would have been a perfect example of a flatus flute in action. But my guy uses, I think it was nitrogen, and it just all got resorbed so quickly that there was nothing to expel. I had no post-procedure flatus whatsoever.
You didn't get the bends?
Nope. No, I didn't get the bends either. So it was weird. So I was very disappointed. That was the whole reason of being excited to have my colonoscopy. I was going to get this viral video, and it just didn't work out. Anyway, all right. Want to take some phone calls?
Let's do it.
Number one thing, don't take advice from some asshole on the radio.
All right.
Hello, Dr. Steve. This is Adam from San Diego.
Hey, Adam.
Got a question about euthanasia. Just recently put a cat down, and I was talking to the vet, and she was talking about what she was injecting. It was first the propofol, put to sleep, and then an overdose of phenobarbital. And I asked her, with the prisons, I guess there's a shortage of the injection medicine that they use in prisons. Why can't they use the same medicine that they use to put our pets down? And that's about it. Thanks. Bye.
Yeah. Do you want to speak on this? Because
the drug companies don't really want their medication used for. Give yourself a bill. We'll go with euthanasia or executions. Pentothal, which was what they used to use and is no longer manufactured.
Thiopental.
Thiopental,
right.
Pentothal. I guess it came out before lay people knew what medications were, so it was okay. But with propofol, those manufacturers do not want that brand associated.
Yeah, it says authorities are struggling to find drugs used in lethal injections amid a shortage spurred in part by drug makers' objections to the death penalty. So, yeah, they just don't want to be associated with it. So now phenobarbital, generic, you could basically buy that from anywhere. The other part of it is the state has to have legislation saying what they're going to use. And sometimes now there's legislators that don't want to be involved in the death penalty either, so they're real slow to change those rules to allow other drugs to be used. And so that's the other thing. It's politics all the way around, from the drug manufacturers and the legislators. Some states are very nimble and can change quickly and have, and I can't name any offhand. I was reading about this.
Lethal injection was kind of a cocktail that was legally prescribed. And now that one of the main medications is no longer used, it's running into that legal conundrum.
Right. What Kevorkian did was he used, I can't remember what his thing was, but he had a 2-step process by which he would sedate the machine that the patient would actuate. That was the key, was the patient had to actuate it. The minute Kevorkian pushed the button for one of his patients, that's when he got sent down the road for killing somebody. But as long as he could make the machine and let them do it, and I think what he was doing was a sedative, and I'm not sure what it was. I'm going to look it up here in a second because we're on podcast. We're not on satellite radio, and we can pause for a second if we need to. And then I think he used a lethal injection of potassium. And potassium, if you get enough of that, it will just stop your heart. So let's see here. Kevorkian machine. Let's see if we have anything here. Oh no, there's a Wallach Kevorkian rotating biopsy punch. So, by the way, if you guys ever had any questions of whether Kevorkian was a serial killer or not, just Google Jack Kevorkian artwork and then tell me what you think. Have you ever seen his artwork? It's the most disturbing stuff. Let Lady Diagnosis bring it up on her phone. And, what is serial killers? What do they like? They like to have a trophy. Well, he would videotape all of his, ostensibly to document it, but he had the videotape. And what else do they want? They want notoriety. Well, he certainly had that. And they need to be a psychopathic
that's some crazy
have a
stuff.
psychopathic disorder. And then if you look at his artwork, it was the creepiest shit. It's very disturbing. Mm-hmm. So, he's not with us anymore, so it would be hard to, of course, he would deny it. But what a greater thing for a serial killer than to figure out a way to do it and do it in public and not get in trouble for it. Yeah. So,
and kind of be praised for it.
Yeah. Well, he did there were people who were in the Hemlock Society who were totally on his side, and rational, well-thinking people can have a discussion about whether this, physician-assisted suicide is ethical or not. And there are states in this country where you can have physician aid in suicide, where you can write a lethal prescription for somebody. They have to take it. You can't administer it.
Right. Oregon.
Yeah, Oregon is one of those. That's exactly right.
I didn't realize that was legal.
One of two.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Let's see what Kevorkian used. Let's see if I can find it. I can't find it. Yeah, anyway. Okay. Kevorkian assisted others with a device that employed a gas mask fed by a canister of carbon monoxide, which was called the Mercytron. This became necessary because Kevorkian's medical license had been revoked after the first 2 deaths, and he could no longer have legal access to the substances required for the Thanatron. Okay, so that was his first device. Invented by Jack Kevorkian to use this device, he called it a Thanatron, or death machine, after the Greek demon Thanatos. It worked by pushing a button to deliver euthanizing drugs mechanically through an IV. It had 3 canisters mounted on a metal frame, and each bottle had a syringe that connected to a single IV line in the person's arm. One contained saline. Another contained a sleep-inducing barbiturate called sodium thiopental. There we are again. And the third, a lethal mixture of potassium chloride, which immediately stopped the heart. And pancuronium bromide, a paralytic medication to prevent spasms during the dying process. So he would paralyze them. Of course, they couldn't breathe when they're paralyzed either, and then he would stop their heart. So
that's the same thing they use for lethal injection for execution.
Is that the 3-step? Is they use? Okay, all right.
They put them to sleep, paralyze them, and then stop their heart.
Okay, well there you go. So I guess that's. So
if you're asleep, you don't have pain, correct?
Right. No, it's humane in the sense.
Yeah.
It's there's no question that it's humane in the sense that you're not inducing suffering. The question is it ethical? And that's where we can have a discussion about that.
Right.
Well, okay, so thank you for bringing that up. There is this thing called the principle of double effect. Did you get taught that? Okay, so the principle of double effect is an ethical principle that's pretty old. Thomas Aquinas was the first one that elucidated it. And what it says is basically that you can do a procedure or some intervention on someone as long and it could have a negative outcome. As long as you don't intend the negative outcome, and I'm going to bring this into what we're talking about, and that the thing that you're doing is morally good or at least morally neutral, and you're not intending the bad outcome to achieve the good outcome. So let's use this for a hospice patient that has terminal agitation, okay? And this is where 2 to 3 days before they expire, they just start getting wild and they're thrashing around trying to get out of bed, or they're really in distress. You've tried A, you've tried B, you've tried C, you can't get them under control. And so you've decided you're going to sedate this person. Mm-hmm. And there's lots of things you can use: phenobarb, propofol, Versed, or midazolam, and to sedate this person. Well, when you sedate them, they can't eat and they can't drink. You can give them IV fluids and stuff, but you're probably going to hasten their demise by doing this. So that's a possibility that you could hasten their demise by making them, in a basically medically induced coma, right?
So as long as that's not your intent.
Well, okay. So if you did that to an 18-year-old that was expected to get better, that would not be an ethical move.
Right.
Because they're expected to get better, and so sedating them to the point where they die would be basically malpractice at best and murder at worst. If you sedate this person who's expected to expire in the next 2 or 3 days and you reduce their lifespan by 30 minutes or a half a day, but your intent is to relieve their suffering, according to the principle of double effect, that's an ethical move. Okay? And remember, the key part of this is that the bad effect cannot be your intent to achieve the good effect. Gotcha. So relieving suffering is the good effect. The bad effect is that they're going to hasten their demise. Where Kevorkian got crossways with modern medical ethics was he was intending the bad effect. In other words, he was intending the person to die to relieve their suffering. Okay? So now, ethics and calculus. Right? There's no right answer. These are just things that we've agreed on, that a bunch of us have agreed, yeah, we agree with this, that this is ethical. But you could have an argument with that and say, well, wait a minute.
So you just have to say it out loud that you're intending to relieve their pain?
You write it in the chart, yes. But basically that's the same thing.
Okay.
You're intending to relieve suffering, and you've discussed the risk, benefits, and alternatives, and one of the consequences may be hastening the patient's demise. The family understands the risk, benefits, and alternatives and wishes to proceed. That kind of thing.
Right.
And then you're good.
Right.
With that principle. And that's a defense in court, too, is using the principle of double effect because it's generally accepted. Could you be a well-meaning, intelligent person that thinks that what Jack Kevorkian did was okay? Heck yeah, you could. It's being done every day in other countries and in Oregon, and I think Washington's the other one. So
I have a question.
Yeah.
So what's the difference between euthanasia and just pulling the plug if a patient's unconscious?
Okay, so patients have the right to refuse any medical intervention that they want.
Right.
Okay. They sometimes lose the ability to exercise that right. So when they lose the ability to exercise that right, that falls to other people who care about them to make those decisions for them. It's called substituted judgment. And withdrawing treatment from someone is not the same thing as euthanasia, because when you remove a ventilator from someone, it's not that act that causes them to leave this world. It's the underlying condition that causes them to leave this world. The life support was merely interfering with that process.
Okay, I see.
Okay, so now with euthanasia, you're actually making steps to cause someone's demise by giving them a medication or whatever, or pillow over the head or whatever, Okay,
Gotcha.
So does that make sense?
Yeah.
Okay, all right. Kind of a heavy topic, but something we need to talk about. All right, let's do one more. This one's good.
Hey, Dr. Steve. Really like the show. I had a question for you, wondering what your opinion or what you know about acoustic pressure wave therapy for ED. Thanks for your answer.
Yeah, are you guys doing any of this?
That?
No.
Okay, so it's low-intensity shockwave therapy for erectile dysfunction. And, people have erectile dysfunction. For whatever reason, they're not able to pump more blood into their penis than is being pumped back out. That's really it. It's a mechanical thing. And when you get an erection, you open up the arterial side and you kind of shut down the venous side. So blood gets pumped in. It's a little bit harder to pump back out. And because of physics, you get an enlargement of the penis, hopefully, and a stiffening of the penis because the sheath around it is somewhat elastic, but it's not completely elastic. It will stretch to a certain level, and then it will stop stretching, which is good, because if it was infinitely stretchy, when you pumped more blood in than you pumped out, you would just get a big balloon, big purple balloon penis, which wouldn't be very good for impregnating somebody. Or having intercourse with them, and it'd be hard to get your mouth around. So it is. It behooves us to try to increase blood flow to the penis by whatever manner we can. And one way that we can do that is with medications like sildenafil that increase nitric oxide in the bloodstream. Nitric oxide helps to dilate the vessels pumping blood into the member, and you get these nice big meaty erections. I like Cialis is my favorite, but Levitra and Viagra are also good choices. But there are other things that you can do, and there's this low-intensity shockwave therapy. The other things that we can do now are alprostadil injections or alprostadil suppositories that you shove down the urethra, and it also causes increased blood flow to the penis. You can use a vacuum pump where those have a cock ring on the end of them, and you stick it over your member, and then you evacuate the air. Well, that negative pressure draws blood into the penis, and then when you get it, to the size that you want, you just slip that cock ring off, and that traps the blood in there. And then you've got this sort of big purple, pulsating thing.
Meaty.
That's also meaty. Yes, it's very meaty. And then, so those are the things that we have now, or an implant. You can get a urologist to implant a new, set of tissues that will enlarge. Some of the old school implants would be just permanently erect. So I don't know how that would be good.
How does shock work, though?
Okay. So yeah, I just wanted to give a little background on what we have now. So this low-intensity shockwave therapy, they did a randomized clinical trial comparing 2 treatment protocols. And what they found was that patients benefit more in sexual performance from 12 sessions twice a week compared with 6 sessions once a week. So you got to do this. You got to commit to it. And it's basically a little device that gives low-intensity acoustic shock waves to the tissues in the penis. I'm trying to see here. They recommend it to people. This study, they used people that did respond to phosphodiesterase inhibitors. In other words, these people can achieve an erection. They can't do it on their own, but they could with medication. They wanted to see if they got better with this treatment, so they didn't need it. And so they did twice a week for 6 consecutive weeks. And people who completed a 6-month follow-up were offered 6 additional sessions. So let's see.
So is this something that's supposed to just make you, train your penis to get hard again, or is it ongoing?
Nope. What they think is that it induces growth factors. It's almost like stem cell treatment in a way. I mean, it's a way to think about it, that it induces growth factors to reconstruct the blood vessels and the little arterioles and capillaries that feed the penis. That's what the hypothesis is. And let me just see here. When the impact of the total number of sessions received was examined, they got an improvement in their erectile function score up to 62%, 74%, and 83% of patients, and that would be 6, 12, and 18 sessions respectively. No treatment-related side effects were reported, so this really seems pretty effective. We'll do cancer treatments because 5% of people get better,
Yeah.
So he was just wanting to know if it was effective? That's interesting.
Yeah. So
is it like something you put on?
No, they would do it'd be like an ultrasound probe kind of thing, and it will do this sort of vibration. I don't know what the character of the vibration is. It says it's low intensity, so it's not like getting your kidneys busted, which is high intensity shock or extracorporeal shockwave therapy. So, anyway.
That's interesting.
Yeah, it is. I'm going to try it just for fun.
You should.
I'm like Snoop Dogg. I don't have a problem, but you might. Have you heard those commercials of his? That's hilarious. Anyway, thanks to our listeners whose voicemail and topic ideas make this job very easy. Thanks to Dr. X and Lady Diagnosis. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.